Welcome to the Strategic Health Services Client Webinar. Our goal today is to provide information on some of our new and value-added programs, First 5 Weight Loss, Tobacco Cessation, and UtiliFit Exercises and Walking Challenges to help enhance your My Pathway to Health Wellness program and further stimulate participation and engagement. I'm Cara Tarantino, the Director of Marketing, and I have with me two of our exceptional health coaches, Dawn Kutch and Crystal Henderson. Dawn will be speaking in just a moment about our First 5 Weight Loss and Management program. Dawn has a BS in Health Sciences and a Master's in Exercise Science and Biomechanics. Dawn has coached over 130 people on the First 5 program to date, and you'll see in just a minute how over 70% have lost weight and approximately 40% have lost at least 5 pounds. Crystal will follow and talk about our smoking or tobacco cessation program. Crystal has a master's in public health with a concentration in health and behavioral education. Crystal is exceptional at helping smokers identify their stressors and triggers, and has guided many members in making critical behavior changes that has helped them quit. Following, I will briefly demonstrate our UtiliFit sedentary disruption program and a zombie walking challenge that our company is currently doing. In fact, we're on the final of our 6-week program. So without further ado, I'm going to turn the presentation over to Dawn.
Thank you, Cara. Okay, so reaching and maintaining a healthy weight is very important for one's overall health and can help you prevent and control many diseases and conditions. Because if you're overweight or obese, you're at a higher risk of developing serious health problems, including heart disease and high blood pressure, type 2 diabetes, and others. And that's why maintaining a healthy weight is so important. It helps you lower your risk for developing these problems, helps you feel good about yourself, and gives you more energy to enjoy life. For those who are overweight, oftentimes getting started is the hardest part. So at Strategic Health Services, we've developed a program to help our members jumpstart their weight loss journey. And the program is called the First 5. Next slide, please. The goal of this program is to help the member lose their first 5 pounds, hence the name, and then get them on their path to long-term weight loss and their long-term goals. The program provides education and monitoring, whether it be self or centralized monitoring, and guidance on what it takes to lose weight, as well as the support needed to continue the journey. Initially, the program is 6 weeks, but the members have the ability to continue with their health coach support even after the formal program has ended. We discuss a variety of topics and utilize intrinsic coaching, assuring that the participant owns his or her own goals and plan. Because everyone's weight loss journey is different, including their different barriers and struggles, the program is flexible enough to allow the health coach and the participant to focus on their specific needs. Next slide, please. The outline for the program generally includes these session topics. We review the importance of setting ongoing goals for themselves, self-monitoring, and adjusting the plan as needed so that once the program is over, they can be confident to continue on their own if they like. We delve deeper into the barriers for weight loss, both real and perceived, and we discuss meal planning and overall the importance of having plans, and especially to overcome their barriers. Some may struggle with emotional eating, and this may become the focus if needed. Before the formal program ends, we discuss the member's ongoing goal and plan and determine what type of ongoing support they would like. Next slide, please. So this program can be offered voluntarily as an added benefit where anyone who wants to participate can, but I would highly recommend encouraging trying to focus the program to a population that will benefit from it and not just want to participate for a prize. The employer might choose to incentivize participation by offering points on a scorecard or maybe some sort of a drawing for all participants who complete the program. But some make it a more targeted intervention by encouraging participation for those above a certain BMI. Incentives offered might include a discount or a reduction in insurance premiums or some other meaningful incentive for your specific population. Incentives may be offered on the successful completion of the program for each. For example, one of our clients offers a gift card to anyone who has actually lost at least 5 pounds. Others may just decide to offer some sort of an incentive based on reduction in BMI from year to year. Next slide, please. Strategic Health Services has a very proactive approach for getting members engaged in the program. In partnership with the employer, a communication plan is devised to orient members to the program, benefits, and how to get started. It is very important for members to know that they have the full support of their employer to participate in the program. This really allows them to get more engaged and take the time that is needed in order for them to overcome their weight loss barriers. And our Strategic Health Services staff also actively reach out to qualified members. Our coaches use intrinsic coaching methodology, as I mentioned, where the member is their own change agent in their own lives, and that they themselves have their own derived unique answers to achieving change. And this really allows them to have real ownership in their own health and their weight loss journey. I often tell my clients that this is your wellness journey and I'm just along for the ride. But this coaching method, along with a variety of trackers that are available on the My Pathway to Health portal, are used to monitor progress and the success of the program. And some of these tools are the food diary, there's a weight tracker, exercise tracker, there's a stress tracker, maybe stress or emotional eating is a factor they might use. Additionally, there are trackers for blood pressure and blood sugar that can help members realize that the changes that they're making can affect other areas of their health as well, especially if they have hypertension or diabetes or prediabetes. But along with improvements in these other conditions, you may see healthcare claims decrease, saving not only the member money, but the employer as well in the long term. Next slide, please. So obviously weight loss is a sign of success. Many have lost more than 5 pounds. I think the highest I've heard thus far is someone has lost 40 pounds. Also, several have lost in the 20s and double digits. Many have lost at least 5 pounds. However, there are some people that have struggled with even maintaining their weight due to health conditions such as thyroid disease. Some have had like joint replacements or are on steroids for other conditions. Some women going through menopause. In these cases, minimizing weight gain or even achieving a small weight loss, even if it's not the 5 pounds, is considered success. Next slide, please. So here you can see that some of our client results are on this slide. And Larissa is one of our members that offered some feedback on the slide, but we've had other feedback as well. One member found it difficult to even meet any of the specific goals in the program, and she was a real naysayer. She was not happy about having to complete the program, but she has been working through some food issues, and now, even though she hasn't lost weight yet, is one of the biggest supporters of the program. So that also, to me, shows success. Next slide, please. So this program guide provides the member with the outline of the topics as well as what pages to prepare for your call with your health coach for each session. There's a 34-page booklet that is available on the My Pathway to Health portal in the Health Library that they can download, or they can review online before the coaching call the associated pages for that call. Next slide, please. Part of the coaching process is to drive people to the other resources on My Pathway to Health portal, such as the map and the trackers, so that the health coach can see their additional goals and progress, whether it be with specific exercise goals, steps taken, servings eaten. If the member has other conditions, they can benefit from weight loss. They should use also like the blood pressure and glucose trackers that we talked about before. As appropriate, we may refer members to additional wellness education resources that are there on the portal as well. Next slide. On this slide, you'll see many of the trackers that are available, and the members can choose to use whatever makes sense for them. A benefit of the program is to get really engaged with the available tools so that they can continue even after the program's over to use them and further benefit their health. Continuing to use these online wellness resources as well as health coaching after the program's over will assure that the healthy habits and behavior changes achieved during the program can be maintained and hopefully become their new normal. One of our first success stories was Ron, and he really took advantage of this. Ron had his aha moment when he had a routine physical with his doctor and learned that he had type 2 diabetes, sleep apnea, and other conditions as well. And so when he connected with his coach for the First 5 program, they worked together on his plan and on his goals. And with the program, he lost 15 pounds. But even after the program was over, he continued losing. He lost a total of 55 pounds, and really it's because he stayed engaged with all of the tools and trackers and with his health coach even after the program was over. And he is no longer diabetic, and he's improved his other health conditions as well. Next slide, please. So in his case, he reversed his diabetes. It is a known fact that the onset of type 2 diabetes can be delayed or even prevented with lifestyle changes. Specifically, exercise and healthy eating habits and weight loss are important. And these are all areas that are focused on with the First 5 program. And the ongoing benefits are endless when you consider the prevention of these diseases. So additionally, avoiding tobacco or quitting if one is a tobacco user is another factor. So next, Crystal will review our tobacco cessation program. Crystal?
Hi everyone. So avoiding tobacco use is very important. Smoking is a major risk factor for heart disease, heart attack, and other coronary heart disease risk factors. So when combined with other risk factors such as unhealthy blood cholesterol levels, high blood pressure, overweight or obesity, smoking further raises the risk of these conditions. The chemicals in tobacco smoke can also harm the blood cells. They can damage the function of the heart and the structure and function of the blood vessels. So here at Strategic Health Services, we've developed a program to help our members get motivated to quit smoking. Now we understand how difficult it is to get started, but the smoking cessation program is a great start to the journey of quitting smoking and tobacco usage. The tobacco cessation program is designed to meet members wherever they are in the quitting process. Session 1 begins 2 to 4 weeks before the quit date. This really allows the member to set a quit date goal for themselves and allows them to move at whatever pace they are ready for. The sessions are designed to be convenient for the member as they can be communicated via secure messaging on the My Pathway to Health website or phone contact with their health coach. The initial follow-up is 2 weeks after the quit date. However, most success is found with additional follow-ups with the member. However, it is at the member's discretion on what they prefer as a follow-up. In most cases, smoking is habitual and mental for most of the members in the program. It's really important to start new habits of not smoking or using tobacco products. Many are able to quit by completing the program and have been able to quit without slip-ups. Identifying a motivator is a huge component in quitting. One member in particular needed to have knee surgery but cannot proceed with the surgery until she was able to quit smoking. So for the members who are not able to quit completely, by the end of the program they are able to cut back on their smoking tremendously, which also helps with slip-ups and future tobacco usage. To get started, the member can contact their health coach. It is very important to review the resources on the My Pathway to Health website. They're located under the Health Library. The materials include a tobacco cessation booklet, a journal, a Crave journal, and also the tobacco cessation guide. This gives the outline of the program. The first step is to identify a quit date, and the sessions will start 2 weeks prior to that. So we as health coaches recognize how difficult it is to quit smoking, and we encourage as many follow-ups as needed. We are here to help in any way that we can. So this gives you the guideline for the program. Session 1 is 2 to 4 weeks before the quit date along with Session 2. Session 3 is 2 weeks before the quit date. And then you have the remainder of the program along with the follow-ups. So some of the benefits that members really identify with is that they feel as though it helps them identify that smoking is habitual and mental. And they also are able to identify their triggers and target them appropriately. The program really helps members consider the pros and cons of quitting, understanding their addiction and cravings and triggers, and steps to take while quitting. it also helps them create new positive habits. Members often struggle with finding an alternative for their stress management. The program really does help identify a suitable replacement for them that's specific to their lifestyle. One member in particular was really able to replace their smoking habit, which was a huge stress coping mechanism, and she actually started to exercise and incorporate other hobbies that she enjoyed. So that is it.
Thank you, Crystal and Dawn. If you have any questions about either of these programs, you can type them into the sidebar on your screen. Your account managers will be following up as well, just to make sure we touched upon everything you might have been thinking about or questions that you have. I'm going to move along now into our health, entertainment, and gaming component. This falls under two categories. The first one is walking challenges. These are team-based online challenges. Teams have 5 or more participants. Steps are tracked. We have a zombie challenge and an alien challenge, and I believe this summer there is also going to be an Olympic walking challenge as well. It's a 6-week online health coached challenge. Communications are done online, and if you have a walking challenge, you also get the Utilifit sedentary disruption games and activities. Those will be available on the portal this fall, but they do come with the challenge. So they kind of work hand in hand, and I'll show you that in just a moment. We work with you on orientation, and we already have space available coming in September. I do encourage you, if you're interested in this, to do a trial yourself, maybe with your leadership team. Those of us at Strategic Health would love to be on a team with you to give it a try so you can experience firsthand. A lot of time it's hard to communicate it internally if you really don't have that firsthand experience. So we really welcome the opportunity to work on that with you. Again, this is just kind of a picture of Utilifit. It can be done on an individual basis. It balances the challenges out perfectly because you know, we have the team-based approach and then we have the individual. These Utilifit is geared towards any type of worker, people who are on the road, people who sit at the desk. It doesn't mean, I mean, people who have never exercised before in their life, people who rarely get up out of a chair will really find that they can do these exercises. The notifications are pushed via text or email, and everybody has that option to choose which they prefer. Just to briefly go over the pricing, we wanted to be fully transparent with these programs. They do have additional costs. The first 5 and the smoking cessation are $50 per participant. We do have hospital clients. We realize that if you provide your own coaching, then it's $25 to use our health coaching platform, which is the technology that supports these programs. The walking challenges are $35 per participant, and if you sign up for 2 in a year, they're $25. We also offer fitness devices at discounted rates. We can help you get stretch bands with your company's logo. We're not really in the business of providing these things, but we feel so strongly in the value of these programs that we really want to help you with any other you know, devices, tools you need to get these programs up and off the ground. We know engagement is key, and these are just other ways to get employees more engaged. So what I'm going to do is kind of switch over. This may be a little cumbersome to the Utilifit, so you can get an idea of how this works. Just close out of this first. Okay, what I'm going to show you on my screen is I elected to have Utilifit sent to my email So when I get up in the morning, this is the first thing that I'll see. And there are hundreds of activities and games to choose from, but there's always a game of the day. So the first thing I would do would go in, and you can do this at any time. Get into Utilifit, and we click on the game of the day, and the first thing you see is sign-in box. And you come to the zombie challenge. So here's one of the first things, and these are chair squats. I'm up to 18 repetitions because I've been doing this for a while now. Somebody who's starting out initially might only be at half of that, and then the program knows that I've been involved and I'm doing this, so it increasingly adapts to the level at which you're doing. So once I've done my chair squats, I click on I did it, which is always great. We get knucks, which is the fist pound there. And so far, this is my first challenge for the day. Other people in the office, if they signed up and they started this at 6 a.m., they may be further along throughout the day, but it's still based on the period of time that you have to complete it. And as you can see right now, I'm in third. And then I just click on continue. So what I'm going to show you a little bit about is, before I take you to the zombie challenge, you can turn this volume on and off. So you go in there and turn it off. I'm going to go back into system feed. So this is what it looks like. Today I've already taken 2,200 steps. We've kind of committed internally that we need at least 10,000 steps a day, which is probably what you're very familiar with. Here shows that I just completed a challenge for the maximum knucks. So you can see how other people did. Bob Powers is in our office. He's on my team. He did the same thing. On the left, you can see my next challenge is going to be up soon, or in another hour. Over here, this is my progress for the week, and I get more points by tracking the, excuse me, losing my train of thought. I get points for tracking healthy lifestyle habits. For example, bringing my lunch in, the number of meals I cook at home. I get additional points for doing exercise in addition to those challenges. And these are all recorded here. Here are some of the things. I'm getting more points today for the Stairmaster. I usually sleep well, so I'm getting 100 points for that. So, you know, as you move along in the challenge is all this healthy eating and healthy lifestyle just contribute to your team doing better. So now I'm going to go back to the zombie challenge, and you get very cool graphics. Here's my avatar, this big guy. I decided to choose him because I wanted to just have more of a presence. So as you can see, this is our last week, and the zombies are gaining speed. In the very beginning, the zombies are computer generated, and then what happens is every week they up their number of steps and the intensity. So they're getting closer. So today we've got quite a challenge for us. This is our team right here. I'm pretty far down because I've only taken 2,200 steps. Some people have taken a lot more. Here's our health. We are in first place, so that's good. I'll kind of switch over to the other teams that we're up against. This team's in third place, and the zombies are gaining intensity, so that's why you can see them catching up with us. The chapter is what we've done this week, and the episode is what we've done for the 6 weeks. So as you can see, there's quite a few steps that everyone has taken. And it's great to have this visual every day. And then within our team communications, and I'll show you where you can do that, right here is the opportunity to communicate online with your own team. You can communicate with everybody in the challenge, but if you want to encourage and support your team, so if you guys end up doing a challenge with us, even as a test, this is what we would use to, get your handle on what you think about it, what you think your employees would do with it and how they would like it. So it's a lot of fun. It's very engaging. It can get very competitive or not. It's really up to the individuals. But there's definitely benefits in changing behavior and everything. So I just wanted to share that with you. I want to be respectful of everyone's time. I know everybody is busy. I encourage you to ask questions about all three of these programs. They're great. We believe that programs that people start and stop are very important to an entire wellness plan because they help re-energize people. The other thing that's an option to think about in the back of your mind, if you're considering the walking challenge and First 5, we can work with you to combine the two of them together. And that's really an ideal situation because while people are working with their health coaches and losing weight, they can also be part of the team and the walking challenge. So with that, I thank you for your time, and please look for your account managers to be following up and get some feedback. Thank you very much.